Thanks very much. Hello everyone, my name is Michelle Mooney and I am Project Coordinator for Seasons of Life.
And I'm Sinead Hannon, I'm Project Lead as well for the Seasons of Life.
So we're absolutely delighted to be here, never mind winning, and well done to everybody else in our category. So we're from the Southern Trust. It is one of 6 health and social care trusts in Northern Ireland. This is our project team and they've all been amazing and we couldn't have done the work without them. So last year we applied to the Q Exchange Health Foundation for an award, and we were the only award-winning project selected in Northern Ireland, and the theme for that was working together across organisational boundaries. So these are all our stakeholders in this diagram. So we've worked with many teams in our trust, like our QI team, and outside of the trust we've worked with education and the like of crews. So bereavement is a public health issue, and I work as a school nurse, and I've worked with many families who have just hit crisis level because of a bereavement, and that there has been no support for them. So bereaved children there's a very grim outlook for bereaved children looking at these statistics. So they're at risk of exclusion from school, attempting or completing suicide, being involved with the criminal justice system, and numerous other stats. And we feel that we could be helping them. With early intervention, there are factors that we could influence, such as preparing children for loss, family environment, supporting that, and their views about themselves and the world around them, and to provide them with some strategies to improve their coping. So we had the initiative of providing bereavement workshops in the school setting, and initially these were for bereaved children, but then we found that children have those grief feelings from numerous other losses, like parental separation, being in care, refugee children, maybe a parent or carer with a terminal diagnosis. So we opened the workshops to any child that felt they needed support with their grief. So the project is unique to our trust, and it's a collaboration of staff from healthcare, education, voluntary and community sector, and we've all worked collaboratively, keeping children at the heart of everything we do. So the workshops are delivered by a multidisciplinary team in the school setting, and we have based it on the Tree of Life, which originated from the Dulwich Centre in Australia. So just a bit like the secret garden, we use the tree as an analogy. So the children draw or paint their tree, and they tell their tree story back in a smaller group. So they use their roots to talk about where they come from and significant people in their life. Their trunk is their values, skills. The branches are the hopes for the future. And the leaves are significant moments in their life. See, there's some pictures from our workshops. The white tree, at the start of the workshop, the children would write the name of the person who's died or their loss and hang that on the tree just to remind everybody throughout the workshop why they're actually there. They do some group work then on different feelings about grief, and it really gets the discussions going. And then we put they tell their tree story, and then they put their trees together to create a forest, and then we talk about seasonal changes. So how we did this, we used service user involvement right from the very beginning. So we have family members, young people, teaching staff on our steering group. We provided pre-workshop and post-workshop questionnaire to collect data. Not all children want to talk and give feedback, so we put paper tablecloths on the tables for them, and they would have wrote some feedback as well as maybe doodling if they didn't feel comfortable sharing that verbally. Semi-structured interviews, and the key was a focus group that we had with the young people. So with the help of our QI team in the trust, we came up with the idea of using a 1-2-4-all liberate and structure technique. So that was a really useful brainstorming activity. So it helped the children to think about their responses independently, in pairs, in groups of 4, and then back to the wider group. And it was just a really powerful focus group, and they really engaged well with us and were very open and honest. So these were the themes for the focus group. We asked them what they liked, what they would change. Did they understand the activity of drawing or painting their tree? The supports that we signposted them to. It was like a stepping stone on to further supports and what our next steps should be. So we themed the feedback. At the start, the children would have drew their tree with markers on paper, and they had suggested then about painting the trees. I mean, I paint them on canvases. We talked about having music in the background. We've all seen today how therapeutic music can be. About soft lighting. Again, going for walks. We'd heard that about the fresh air in the secret garden. And having more fun. And they said they felt guilty having fun and laughing outside of the workshop, but it being in the workshop gave them, you know, that chance to have a laugh with their peers who were feeling similar to them. They wanted more workshops. Some children wanted them every week, some every month. Some people just to get out of class, but that's okay too. They really felt connection with one another. The workshops made them feel less lonely, and getting into school like a year later, children who didn't know each other at the start are now really good friends with one another. And they liked learning about grief as well, because we incorporated that into the workshops.
So one of the things about quality improvement is the importance of data collection. So right from the beginning, we had our data that we collected right from baseline through to pre and post our workshops. So we collected quantitative and qualitative data. So some of the results from the quantitative data was an increase in skill learning in terms of their resilience and coping. One of the big things was a higher level of knowledge and support, particularly with regards to knowing what supports they could access outside, either inside a school or outside a school. And one of the things that we were able to see, the teachers gave us feedback, is that the young people engaged with both school resources as well as education and trust resources that they hadn't engaged with before. So it really broke down the barriers to engagement with services. Everybody felt it was useful, and they all wanted to come again, and some young people did come multiple times. So the request to return, the big thing as well was word of mouth as well. So more young people came because of the positive experience that the young people got. So just some of the feedback. There are some particular ones that were, I suppose, as a team, the stories that we were hearing every workshop in terms of the bereaved, their experiences was very powerful, and we were very privileged as clinicians to be able to hear those stories and honour those stories. It had a ripple effect through families. One particular grandparent had said that the rest of the family engaged with bereavement services because the young person benefited so much for their own workshops, so that was very powerful in terms of a systemic impact. And also teachers noticed as well that it was helpful for them in terms of support for them in their own grief journey, so that idea of identifying their own grief. But also they said that there was positive engagement from the young people with the teachers. So our project was also selected by the Public Health Agency to be involved in the Involvement Human Library, and we were very grateful for that opportunity. And 3 young people, teachers, parents, as well as the team, were involved with that. And this was a fantastic opportunity for, again, those young people to share their story, share the impact the work had on them. And using the BGT style of scoring, our project received the golden buzzer. And the feedback was that they'd never seen involvement from service user involvement like it in a project. So some of the outcomes, there's tons of outcomes there, but some of the big ones was that again, the engagement and targeted support for young people afterwards, creation of peer bereavement groups within school, and also bereavement policy came out of that, the schools wanting to create that. We have ongoing memorial artwork that is going in place in one particular school that's going to, again, honour their bereaved story. And also attendance at school of children who disengage from school was another powerful outcome for us. So kind of learning to date, the value of service user involvement at the heart of this project has been the most powerful learning to date. Involvement with the Q community, and also engaging that we were able to bring together trust services, but also education, young people, service user parents, and the independence voluntary community sector as well. Okay, so that's just some of our next steps.
Can we just one sentence for the next steps?
So next step is just that we are looking to continue to the opportunity to raise funding to keep this project going.
Oh, perfect.
Thank you.
Thank you. Thank you very much. Don't go anywhere. Don't go anywhere. Don't go anywhere. Come back, Michelle. She is like so out of here. It's like done. She's always dropped the microphone and she's off. But I know there's going to be questions. Would anyone have some questions? No, I feel they're thinking about it. I was going to say, people need a little moment to think about and reflect. Hanan, so there's a lady in the middle there, and and another question down in the far corner down here. Okay, so we'll go to Hanan first, and then we'll go over to Linda and the...
Right. A really powerful project, really interesting. Thank you so much for sharing it, and congratulations. I was just wondering who it was that facilitated the sessions with the children. Is it a shared facilitation? Is it something specific?
So the facilitation was a joint project between psychology, school nursing, and Crew's bereavement support service, which also do have peer facilitators as well. That was part of that. But although we facilitated, we joined in, so any of the Tree of Life, we were also doing that as well as parts. So we were also sharing in a safe way some of our experiences as well. So it was very much joint art pieces.
Thank you for that question, really thoughtful. Linda. Microphone working?
We have been involved with the Department of Health to develop a children's bereavement charter, so they do know about the work. We've been presenting to anybody who listen. I think I've presented 4 times in the last fortnight, and unfortunately we're just being told there's no more money because all the budget cuts. So we're just extremely proud, and we're hoping that this award will help drive that forward. It needs to happen.
The eternal challenge of money, but hopefully having some kind of reputation from winning will have an impact, and we have heard that in the past. Can't promise. Was there another question, did I see? Did I see a hand up? No? Oh, yes! One more question and then we'll move on.
Hi, yeah, congratulations. It's really, really moving presentation as well. I was just really curious. Sorry, I'm just putting my cup of tea down. I was just really curious because my background was, working with children in grief, and I think it's often the expectation that schools will pick up that support, and not just with bereavement, but wider loss, and teachers don't get any training as part of their syllabus. So I just wondered, is it a kind of, and I'm so sorry because I missed the very beginning, is it a kind of training the trainer model that you're using so that the teachers will then take that forward, or?
Well, we don't have, our plan was capacity building. We were hoping that that the teachers would take that forward, but actually the young people didn't want the teachers facilitating. They wanted somebody external, which is interesting. But the other thing is that we have done, Michelle has done bereavement training to the teachers within the school as part of the project. But we would be very happy to do a train the trainer model.
Yeah, I think it's really interesting because schools often the safe place for children as well, isn't it? So it's always that balance of, is it where you put the support, or is that somewhere where they don't want to go there with these? So it's always a difficult one, but it's an amazing project, and good luck finding money from somewhere.
Thank you. Important work. Thank you very much. Thank you.